Hi, my name is Luis Salazar. I'm a primary care sports medicine physician at Ortho Kansas. So I chose sports medicine as I was finishing my med school career. My brother, as an athletic trainer for the Cleveland Indians, was exposed me a lot as I traveled with him at times and got to visit him. And there was something that was calling me towards sports. As an ex-athlete personally, I saw it maybe an opportunity to blend my science, medicine, and going through medical school. Well, I didn't know that you could be a sports medicine doctor and take care of all of the athlete. And so after choosing family medicine, I went to Ohio State and was there for my sports medicine fellowship under the guidance of a world-renowned sports medicine doctor at the time, who's now my mentor still. And that's how I came here. I think I would want patients to know about me that I'm passionate. I'm passionate about what I do, not only in patient care, but as a father, as a team physician, as a coach to my kids. You know, I'm passionate. I'm present. I also like my patients to know that they'll have options. You know, a lot of times we all come to the doctor with, what if it's this? I don't want to do that. There are always options. I mean, all the options, but we'll have options, and we'll have that discussion openly and make the best plan. And a lot of times it appears they're just going to tell me this. Let's talk about it. And I'd say that all the time. Let's talk about it. My practice is pretty vast. I take care of, and it sounds silly, anybody who moves. And so I take care of, I think the youngest I saw was 6 months old. And I don't even know, I don't want to offend anybody with how old somebody has been, but I take care of everyone. I take care of not only athletes, and at all competitive levels, whether it's elementary, pee-wee, middle school, high school, college, Olympic level athletes, and beyond professional. And so I've had experience in all aspects. And so I take care of a vast amount and cross a lot of age groups in that as well. I think the advice I want to share with my patients is that they need to seek the care and demand the care that they need. They need to push us as physicians as well to not be stagnant. You know, it's not the physician's way, it's what's the best care for them as a patient. And I tell my patients, if it wasn't for you, I wouldn't be here. And so we need to listen to them. We need to value their time. We need to value them. We need to offer options. But we also need to be truthful and upfront at times. And so I tell them, find the care that you need. If it's not me, that's fine. But I think we need to demand the most for our individual care as patients. Patients should come to LMH. This is our home. This is our community. We bring in some of the best doctors, not only in the state, but people want to come to Lawrence. And we can be very selective on who our community is because we're small, but we're large overall. Not only medical staff, but we're able to provide, and we're growing, which is really exciting. And we collaborate really well. And so we can do almost anything here in Lawrence, which is great. It's a few blocks away to almost any facility in Lawrence.